Good morning to you all. I'm Dr. JP Singh. Welcome to our channel. Today on our channel, we'll discuss few MCQs, second in the series. Moving ahead, first, this question says the test in forensic practice to distinguish human blood from animal blood by precipitin reaction is first option Kessel-Meyer test, second luminol test, third Takayama test, and last Ulen-Hu test. We'll read the question again. The test in forensic practice to distinguish human blood from animal blood. We must keep in mind they are trying to distinguish human blood from animal blood, and specifically it asked about by the precipitin reaction, right? So we'll go to the options one by one. First is Kessel-Meyer test. This Kessel-Meyer test is also known as Kessel-Meyer phenolphthalein test. Phenolphthalein test. We all know phenolphthalein is a reagent which is generally colorless at neutral and acidic solutions. It is neutral, whereas it turns into pink or purple color on mixing to alkaline solutions, alkaline substance, right? So it is known as Km phenolphthalein test, and it only detects the hemoglobin. It only detects hemoglobin but does not detect any it only detects hemoglobin but does not differentiate between any species, right? And the color changes around by pink or purple on mixing. So it will tell about only hemoglobin but do not differentiate between the species. Next is luminol test. Luminol test is also known as luminol chemoluminescence test. It is a sensitive test and it identifies hemoglobin by chemoluminescence. It is very sensitive test, as we know. By this test is done by chemoluminescence and sensitive, but do not form any precipitin. No precipitin formation. No precipitin formation and only detection of hemoglobin. Next is Takayama test. Takayama test, also known as Takayama heme chromogen test. Chromogen test. That means it is helpful in detecting only hemoglobin, right? So these first three tests, they detect only hemoglobin but do not differentiate between human blood and animal blood. So heme chromogen test, it detects hemoglobin by formation of crystals. Formation of crystals. And the crystals are pink feathery crystals. They appear like pink feathery crystals. Takayama heme chromogen test. And important to remember in this test is Takayama reagent. Takayama reagent, which consists of sodium hydroxide, sodium hydroxide along with pyridine and glucose, right? Takayama reagent, it consists of sodium hydroxide with pyridine with glucose, and it is effective, again it is effective in detection of hemoglobin in old stains. That is the importance of this test. Old stains, right? So we are left with the last option, Ulen-Hu test. This is the correct option, Ulen-Hu test. So it was diagnosed by, it was the test for it was started by German biologist in some 1900, starting in some 1900, early 1900, and this test, when the blood of two species it is mixed, they form a precipitate. Hence, it is the test which is sensitive to detect or to identify the species. It is species specific and forms the precipitate, right? Moving on to next, the type of skull fracture suggestive of heavy blow to the side of head, often associated with intracranial hemorrhage, is linear fracture, depressed fracture, basilar fracture, or hinge fracture. Right? We'll read the question again. The type of skull fracture. So we must know different types of skull fracture. These are 4, but there, apart from these 4, there are many. There are around 10 to 12 types of skull fracture. Right? You must read and try to identify different types of skull fracture, like linear, depressed, comminuted fracture, basilar fracture, or ping pong fracture. Right? So this question is asking about heavy blow to the side of it. With skull fracture, it also want to know which is associated with intracranial hemorrhage. We'll go to the option one by one. Linear fracture. Around 70% of the fractures in the head, they are linear fracture. They include the whole thickness of skull. Whole thickness of skull. And they are generally difficult to detect, whole thickness of skull, and they are generally difficult to detect on X-ray or radiography. They are generally not seen on radiography, and we need higher investigation for this. And it is because of impact by broader surface force, like falling on the ground, or a weapon which has got wide surface. Right? Next, and it is generally not associated with any intracranial hemorrhage. Now, depressed fracture. Depressed fracture, they are known to be caused by the weapon which has got high kinetic energy or moving at high speed, right? And they are generally touching or affecting the small surface area of the skull. So the transfer of force is over a smaller surface. They are generally caused by object which has got smaller surface of contact and transfer the force at high speed, right? Like hammer like object, and they are also known as very specifically, they are also known as signature fracture. Signature fracture, because the fracture is generally of the shape of the weapon. As a result of application of the weapon on the head or skull, there is the shape of the weapon is there, and movement of the bone inward in the skull and over the brain, and formation of multiple linear fracture from this. Like if it is this, multiple linear fractures will be coming out of this fracture, right? Then we have got basilar fracture. Basilar fracture, so it is because of heavy blow, true, but it is generally not associated with intracranial hemorrhage. Now moving on to basilar fracture. Basilar fracture is due to high velocity trauma. It is due to high velocity trauma. High velocity trauma, and generally it affects the base of skull. So it is ruled out because the question is asking about the side of head. This option is ruled out. It is because of high velocity trauma affecting the base of skull. So generally it affects the chin or the lower side of the skull, right? And important signs which are associated with this are raccoon eyes or the battle sign. It is generally associated with raccoon eyes or battle sign. What is raccoon eyes? If you want to know further, please comment in the comment box. I'll explain what is raccoon eyes or what is battle sign. Right? But this basilar fracture, it is associated with raccoon eyes or battle sign because it is affecting the base of skull, and it is also associated with leakage of CSF through ear or nose. Right? Now the option left is hinge fracture. This is the correct option, and it is because of transfer of the it is a sort of transverse fracture which crosses the base of skull. It is a sort of transverse fracture which crosses the base of skull, and it generally involves temporal or sphenoid fracture, sphenoid bone, temporal or sphenoid bone, and it is also known as motor cyclist fracture. It is also known as motor cyclist fracture. It breaks the skull, base of skull, into two halves like a hinge, right? So the correct answer is hinge fracture. Moving on to next. In reference to dactylography, skin layer responsible for forming permanent fingerprint pattern. It is asking about permanent fingerprint pattern. So we must know something about fingerprint pattern. We will go to the options one by one. Epidermis, stratum corneum, dermis papillary layer, epidermis, stratum granulosum, or the subcutaneous tissue. So before going on to the options, we'll discuss the layers of the skin. So skin is divided into three layers: epidermis, dermis, and hypodermis. This is the main layer. Above it is epidermis, below it is hypodermis. Epidermis forms only some part of this skin. Hypodermis generally involves only the vessels or adipose tissue. It involves vessels or arterial veins, vessels, and adipose tissue. Epidermis is divided into 5 layers, 4 and 5. Epidermis is divided into 5 layers. The topmost layer is stratum corneum, then stratum granulosum, stratum corneum, stratum granulosum, stratum corneum, granulosum. Last one is basal, stratum basal, and then is spinosum. It is divided into 4 layers: spinosum, stratum corneum, stratum granulosum, stratum spinosum, and stratum basal. So, and the dermis, it involves various glands, hair follicle, and the bulb of the hair, and glands, hair follicle, the muscle fiber in form of collagen and elastin fibers, and the last is it involves most with them another part is nerves, right? So this is the upper layer of the skin, epidermis. It keeps on falling again and again and repaired, replaced again and again, sloughed off. Generally, this is the layer which is generally getting damaged and replaced frequently. This dermis includes glands, follicles, muscle fibers, and nerves, and the hypodermis involves the vessels and the adipose tissue. So, as discussed here, in epidermis keeps on falling and getting replaced. It is not a permanent layer. So, these options of epidermis stratum corneum, epidermis stratum granulosum, they are out. And here we discuss subcutaneous tissue. It consists of fatty layers or the vessels. It is very deep. The option left is dermis papillary layer. This is the correct option. Now few words about a permanent fingerprint pattern, they start developing from 10th to 17th, 10th to 17th week of intrauterine life, and they are fixed by around 23rd to 24th week. They are fixed. And if they are getting damaged by some, they appear on some papillary ridges in a permanent pattern. Papillary ridges in a permanent pattern, and by some disorder or disease, if they are getting damaged in some part, new ridges they appear at same places. At same place, new ridges will appear. So this is permanent pattern throughout the life of the individual. Next is Spalding sign in fetal autopsy is suggestive of maceration of fetus after intrauterine death, spontaneous abortion due to infection, deliberate criminal abortion, or hydramnios. First is, what is Spalding sign? We'll discuss Spalding sign as it is overriding of bones of the skull in a case of intrauterine death of fetus. It is overriding of bones of skull in case of intrauterine death of the fetus. So it is maceration of the fetus after IUD, spontaneous abortion due to infection, or deliberate criminal abortion, or hydramnios. Maceration of fetus, maceration of fetus is a form of aseptic autolysis. Aseptic autolysis or decomposition. This is aseptic decomposition. Spontaneous abortion due to infection. It is infection, that means it is a non-aseptic form. It is a septic form, we can say again. It will not lead to Spalding sign, though it may lead to expulsion of complete fetus. And deliberate criminal abortion, this option, or if something is happening in this way, it will lead to damage to body parts of the fetus, damage to fetal body parts, right? And hydramnios related complication, they'll all lead to issues with the mother or issues with the baby, but not in form of damage to the skull or skull bones, right? It will lead to intact skull or body parts, but the damage will be to the respiratory tract or to the GI tract, right? Or in mother, it may lead to overweight, body ache, and some other issues, but not lead to the Spalding sign. So the correct answer is maceration of fetus after IUD or intrauterine death. It is seen with Spalding sign. One important thing why Spalding sign develops is because of loss of tissue turgor pressure. So there is loss of tissue turgor, hence there is overriding of bones of the skull and this we find in ultrasonography, right? Moving on to next. Characteristic difference between choking and smothering. These are two forms of asphyxia, and the specific difference they want to know between choking and smothering. First, choking means external closure of mouth. Smothering is always accidental. Choking results from internal airway obstruction, and smothering never leaves external signs. So what is choking? Choking is obstruction of respiratory tract. Both involves obstruction of respiratory tract. Smothering involves obstruction of respiratory tract by obstruction of mouth. Forceful. It is forceful obstruction of mouth and nose by external agent. It is always, smothering is always homicidal, whereas choking is always accidental. Main difference between smothering and choking is this, and choking is internal airway obstruction. It is always internal airway obstruction, where smothering is external airway obstruction. Smothering is external airway obstruction, choking is internal airway obstruction. Smothering never leaves any external sign grossly wrong. Why? Because we are saying, we already said it is forceful obstruction of respiratory tract. Hence, there will be laceration or abrasion, laceration on inner aspect of lips and abrasion around nose and mouth. Right? This was all from my side. If you have any doubt or any confusion, or if you need any clarity on any of the question or the answers, you can comment in the comment box your queries. I'll try to clear your doubts. Thank you. Please subscribe to our channel and refer our channel to your friends also. Thank you.